Bismillahirrahmanirrahim. Let's start. Can you see my screen?
Yes.
Okay, your time starts now, 2 minutes. After 2 minutes, we will remove the screen. Okay? Take your time, please. I would request all of you to stop the video, please, because it will be recorded. So, your personal safety, please stop the videos. Just a minute. So we will not waste time. Let her read. What we will do 2 recent exam scenario. After each scenario, we will discuss what our participant has done, how he or she performed. We will discuss that one. And at the end of the session, we will try to do correlate, the other scenario that recently coming, at least related to the 2 scenario we are doing today, okay? Because there are so many scenarios in communication. So at least if you know that what are the recent scenario and you do it, so there is actually more than 70% chance that you will get almost similar. And if you are in the because like first diet, some countries exam is going on, okay? So if you are in the second phase, the second country, maybe January, some countries already happening, February, another countries. So there is high chance that the January cases are repeated in the February cases, maybe with some a little bit twisting only, even the same case, the same scenario they're giving. So that's why the recent scenario discussion and doing is very much necessary for all of you. If you are going for next diet, the last 2 diet scenario or the year scenario, like 2026 scenarios, 2025 last diet scenarios, at least we should do. Okay, so now actually 2026, if you do first diet and second diet, that is enough, because it is almost going for the third diet you are going to apply. So don't miss, because it will if you do all the scenarios, then inshallah there is chance and you will get full marks in both of the communication. Okay. Okay, and hopefully nobody is beginner here. If anyone beginner at the end of the session, please ask me if you want to know anything regarding the communication station. But let's assume that now everybody knows. Okay. Anyway, so Dr. Hiba, are you ready?
Okay.
Okay, just a minute here. I will take my screenshot. Okay, so your time starts now.
Hello, good evening.
Hello, good evening, doctor.
My name is Dr. Vahid. Am I talking to Mr. Sharon, 48 years old?
Yes, doctor. I'm Sharon Darsh, 48 years old.
Okay, Mr. Sharon. We are here to talk about your health condition. Is it a good time to talk?
Yes, doctor. Please carry on.
Okay, Mr. Sharon. Before we start our discussion about your health, please tell me, what do you know about your health? What's going on, so we can be on the same page?
Actually, doctor, what happened? I'm having muscle pain, and I'm getting like whenever I'm waking up at the morning, I feel like my whole body is getting stiff. So it's really annoying, and sometimes also I feel feverish, and this is happening for the last few years. So I am also having actually hypertension, but for hypertension, I'm taking medication very regularly, and I'm going to my hypertensive clinic very regularly for checking, for following up. So I don't know, doctor, what happened. They did some blood test, I think. I want to know, doctor, what is happening with me? Am I having cancer?
Okay, okay. Mr. Shannon, I appreciate your concern and I also appreciate your knowledge about your health condition. As you have told me that you are having these pains and you are also hypertensive and you are following your doctors and you went to the clinic and some tests were done. The results of these tests are
Your
back.
voice is cracking, Dr. Hiba. Can you put your
Can you
mouth?
hear me now?
Yes.
And okay. And the consultant has reviewed these results. And Mr. Sharon, I have a very good service for you today.
Uh, yes, doctor. What is this?
So, Mr. Sharon, the consultant has reviewed your results and uh, he's of the view that you are having a condition called polymyalgia rheumatica. Have you ever heard about it?
No, doctor. What is this? It seems like something so serious.
Uh, Mr. Sharon, please don't get scared by the medical terminology. I will explain it. Mr. Sharon, actually, our muscles and everything, they are supplied by blood channels to give them the nutrients and everything. In this condition, our body's defense system becomes active, and this defense system acts against the lining of our own blood channels. And sometimes again acts against linings of the blood channels which are supplied to the muscles, sometimes supplying protection to the organs, to our eyes, and other things. And in your case, the blood channels are affected, which are supplying the muscles, your shoulder and your hips and other by
Okay.
which you are having this problem. You are getting stiffness, pain. Are you with
Your
me?
Yes, yes, doctor. Your voice is cracking. Are you on speaker or on
No,
earphone,
no,
dear?
I'm only
Earphone.
uh,
Okay, I think you can you put your microphone near to your mouth because there is some echoing a little bit. Is it for me or somebody else? We will take another 1 minute, inshallah.
It's not
okay. Can
clear.
you hear me now?
Yeah, now it's clear. Okay.
Okay. Okay. So in your case, Ms. Sharon, your body's defense system is acting against the linings of the blood channels, which are supplying your muscles. And this is causing you all this pain. Are you getting me?
Yes, doctor, I'm getting it.
In this disease, you get all sort of pain and stiffness, and so we have to make a plan to treat it because it can cause you this discomfort like pain, and if it is not treated, it can cause some serious effects like it can cause you headaches, it can cause you vision problem, and it may lead to vision loss as well if it is not treated in time.
Oh my goodness. So you are telling it will affect my eye also?
Mr. Sharon, I'm telling you all the possibilities which can happen if we do not treat this condition. I don't mean to scare you. I am going to share with you a plan which we are going to forward in how we are going to treat you.
Okay, doctor, what is the plan then?
Okay, Mr. Sharon, we will start you on treatment right away. We will start you on medicines which are called as steroids. Have you ever heard about them?
Yes, doctor, steroid, this is a very bad drug. One of my friend, she started on that and she was gaining weight and she told she's having she didn't have hypertension before. Now she's having high BP and I'm already having hypertension, doctor.
Ms. Sharon, I'm very glad that you shared this news with me, that you shared this concern. You are very right. The steroids have side effects. Every medicine, in fact, has side effects. But if when we start a medicine and keep you under observation and keep a tight check you for any kind of side effects, then we will be able to manage these side effects. Steroids do have side effects, but first of all, we will start you on the very necessary dose, which is necessary for your condition to get. And moreover, we are going to keep a lookout for any side effects. We will keep you under observation and we will keep you under our continuous monitoring for any kinds of side effects. Steroids have side effects like gaining weight, and they may cause hypertension and even raise blood sugar levels in patients. They do, if they are given unchecked, they can uh, hurt your gut and they can thin your bones and cause bone pains. But we have a plan for that. First of all, we will give you gut protecting medication along with that. And second, moreover, if you have a propensity of any weight gain, we have a way of involving a dietitian and a physical trainer who will give you the diet and some exercises to keep your weight in check. And if there are other side effects, we can reduce the dose of the steroids and we can monitor these. Are you with me so far?
Yes, doctor, that's a lot of information actually. But yes, I can follow you. So how long I have to use this medication?
Yes, Mr. Sharon, that is a very valid concern. You will be started on this medication, and the consultant will review you from time to time, and according to your symptoms and according to your response of this treatment, he will then slowly taper the dose and then wean you off of this medicine when he feels necessary.
Okay, so it's for like months or years. Time finished, but you continue another 2 minutes, please. Yes.
Uh, yes, Mr. Sharon, I can give you a definite timeline, but I'm talking about some months. And but the consultant will definitely tell you about that according to your response. And one more thing, Mr. Sharon, I want to talk to you is that if you are having any headache and if you feel any blurriness of vision or any problem like that or any pain in your jaws while chewing your food or anything like that, you have to tell your doctor immediately
Okay.
so that these are some symptoms which you have to look out for.
Okay, doctor. And this muscle pain is so much annoying, doctor. How long it will take time to work for this medication if I start?
Ms. Sharon, for this muscle pain, we are going to make a multidisciplinary team and we will start you on this medication and hopefully very quickly you will have a relief of this pain. Along with this, we are going to involve our physiotherapy department and our social services and occupational health department as well. So if you are having any difficulty in your daily activities or in your job due to this muscle pain, you can talk to them and they can also help you in this regard. Uh, are
Okay,
you,
doctor.
Miss Sharon? If you don't mind, can I ask some personal questions from you?
Yes, please, doctor.
Do you smoke, Miss Sharon?
No, doctor.
Okay, and do you take alcohol?
No.
Okay, and how is this muscle pain and this all of these things are impacting your daily life?
Yes, a lot actually.
Okay, are you facing any problems with your job or anything like that?
No, actually, I have my own business, so I can tackle it. Thanks for asking, doctor.
Okay, okay, Mr. Shen, I will write the name of this condition for you, and I will also write the name of the treatment for you, and then you can, and I'll give you some addresses
Thanks.
of the websites.
Hmm.
Okay,
Okay, thank you. Thank you for your time, doctor. Okay. Yes,
thank you.
Dr. Hiba. Thank you. Thank you, dear. Very excellent performance. Let's just share the let me share it again. We can discuss it. I don't know, sometimes your voice is echoing actually.
I think I have some internet issue.
Yeah, it could be, or maybe the earphone. I don't know. Maybe with speaker it would be good or something. Next time we would try on that one. Okay. So first of all, very good performance, excellent. And so from the starting, let us start. So you introduced yourself very nicely. You took the golden pause, and also you explained me about the polymyalgia rheumatica. Regarding this planning, actually, I have a little bit, I think, a bit correction, because actually polymyalgia rheumatica itself, it's not any blood channels problem. It is obviously defective, that defensive mechanism. When it is, what happened when it is becoming overactive, what they're doing, they're actually this some healthy tissues are surrounding the that joint. I mean the bursa, the synovial fluid. So usually here what happened, bursitis are happening, synovitis are happening, and ultimately there is like they're having this kind of muscle pain. It's not actually the name, according to the name, that polymyalgia, myalgia, it's not about the muscle involvement or not. I think blood channels, it is you told because of the GCA association. This is a must, you must tell that it is also, it may also affect the blood channels of your head, that could affect your vision. That is, I'm agreed. But the PMR explanation a little bit different actually. PMR definition, if you are telling that time, better if you do like that, that it is the overactive defensive system or defensive system defectively attacking some other parts of some parts of our body which it should not be attacked, right? Which part here you can tell, there's some healthy tissue surrounding your joints. That's it. Healthy tissue surrounding. You don't need to mention the bursa or the synovitis. Healthy tissue surrounding your joints. That's why you are having what you told. That was the perfect. That you have the muscle ache. You all told the symptoms. You are having the muscle pain and the stiffness. Also sometimes the fever I mentioned. Okay, so these are the thing, and you did a perfect job with mentioning about the GCA. This was having the hidden agenda of PMR. Okay, if you didn't mention about, don't mention about this GCA at your exam hall, you will have the mark with this hidden agenda. Okay, they are, I mean, they will search for this one. So GCA, it should be, it is a must. You can talk about it at the starting, like Dr. Hiba told, even at the last also as a red flags. Better at the even starting, so that you will not forget. Okay, whenever PMR is there, it has to be in your mind that you need to tell the patient that it can affect your vision also, because this defensive mechanism mistakenly can attack the blood channels of your head also, which ultimately will affect your vision. So if you do have any problem with your vision, please come back to us as soon as possible, even before your follow-up date. Okay, so you did great regarding this one. Okay, so this is the complication also, one of the complication, right, for PMR. So this is the thing, you did everything with this starting. Then you told about the treatment plan, right? And nicely you told that not to be scared, because I got scared. So whatever the response of the patient, and Dr. Hiba did it very, very nicely, that I was scared. She just calmed me down, that don't be scared. It is not, I'm not telling you to scare you, but I'm telling you all the possible condition that can happen. Okay, we need to be honest. Okay, so she did excellent, she used excellent words. The choice of words also important. So this is the perfect way to tell that it's not because I want to scare you. Okay, but I want to make sure that you will get all the information regarding this disease that you are having, regarding the medical condition that you are having. Okay, it is his or her right, right? So this one is nice. Then you started with our medication. Okay. Medication, you told steroid. Very good. This is another hidden agenda. They will tell only the treatment, but you need to mention that which drug, not in all cases. In some of the cases, you need to mention the name of the drug, like steroid, PMR, steroid. Some other cases also, whenever steroid, it is must, you have to mention the steroid, even if it is not mentioned in your scenario. Because other than steroid, there is no other treatment choice for PMR. So it is a must to mention in case of PMR. So these are the scenario you need to know, that where you should not forget about the treatment. You cannot just tell diplomatically that we are going to have a team, a group of specialists, including maybe the joint doctor and physiotherapist and also occupational therapist. Like that, you cannot just tell and they will give you the treatment. No, here the steroid mentioning, this is the another task. So this case actually have two tasks. One is the breaking bad news. The second one is the starting of the steroid. So these two parts, definitively you need to touch separately and also fully. Okay. So regarding steroid, she did it again very well, that she told that it will be in a very low dose, whatever needed for you, because usually polymyalgia rheumatica, we are starting in low dose. Polymyositis, we are starting in high dose. Okay. There is difference between the polymyalgia rheumatica and polymyositis, right? And even this knowledge, this is for your part 1 and part 2, and this is necessary. It's not like you need to know only here that lowest dose, highest dose. No, even in LCC it is needed. Okay, so whenever you do any case, try to correlate so that you can do the LCC also. Okay, so polymyalgia rheumatica, Pune, this diet, it came for PMR, polymyositis, LCC, it came. Okay, so what is the PMR? PMR, there will be pain and muscle stiffness, but there will be no weakness. But here, with pain and stiffness, mainly the fact is that there will be muscle weakness. This is the difference, that there will be muscle weakness. Okay, so here, low dose steroid, but in polymyositis, high dose steroid. Okay, so she did it well, that she told in a diplomatic way, not in a, I mean, yes, she also told me that whatever the dose needed, in the lower dose, they will start. Okay. The second question, it was the question from the examination directly, RCP examiner, they ask that how long the medication will work. I asked her. Okay, so she also diplomatically, what the answer she told, that was also nice. But if you know, actually this is longer period of time, usually 2 years. So you cannot mention 2 years, but at least longer period of time. This word, I mean, it's not only months. I think you mentioned months, because it actually need years. At least 2 years it is needed, then tapering, and then they're stopping it. Okay, she mentioned about the tapering. And here, if the examiner is okay, 50-50, there is chance that they will not catch it. It's okay how she answered. Okay, but for you now, this is the stage you will learn. No? You will gather whatever small points you missed. So here, just remember, it is for a longer period of time. Okay, years, it is not months. Okay, so this was one of the question. Another question I ask you, that, so one of the question was that how long this steroid I have to use. So the answer is that longer period of time. Okay. The second was that how long it will take to subside my pain. Maybe I will start today, and my pain, how long it will take? Because I cannot bear it, doctor. Okay. How long my pain will be subside? So within 48 to 72 hours, within days actually, it is working. So the main theme, you don't need the time frame. I'm not telling you to memorize the time frame, but at least if you, I mean, you need to tell at least the days, the weeks, the months, these words you need to utter. Okay, so here at least within days you should tell. because this is very quickly, within days actually it is responding, and they're responding very well. Okay, so this was another question from examiner. Okay, then the third, these are the summary from the centers the candidates I have talked to. So this is not from one center. This is actually from 2 to 3 centers with the same scenario. So I tried to gather them together, and I'm telling you, okay, so that if this scenario is coming, not even a single question is missed. Okay, so another question is that, is it curable, doctor? I didn't ask her because didn't have time, and I don't want to bother her anymore. Already I bothered her so many times. It was like I told her, I'm afraid because my friend is taking this side effects. Side effects also, she told it me very well, and also the remedies. Only one small thing I will tell you. Whenever you are telling the side effects, you will see whenever they are keeping silent. I was keeping silent. You told side effect for a longer period of time. Don't take so long period of time. In between, just check my understanding. This is also important. Whenever you see that the examiner is stopped, that means they want you to cut that mark in that sense, that you are giving a lot of information within a sentence. So at least in between, maybe side effect there are so many. So in between, if you just, are you following me? You told me, but I think after so many lines, when it was already maybe 1 minute already there, and then you asked me. So in between, don't take too long time to it should be two-sided conversation. So if you are taking longer period of time to take giving one information, this is also a negative point. Okay, so this is the
Okay.
third point there. Okay, so another thing was there regarding steroid, anything else? Okay. Another question was that they told that, here I told I am a businessman, but there was one job holder was there, and he was telling that it's hampering my work. So obviously, if I'm telling you, what will be answer? You will give me arrange sick leave, right? If job, you can ask them for sick leave, and we can arrange sick leave for you. And if it's still there, then we will take care of it. If still the pain is there, but hopefully till the pain is subsiding, we can give the sick leave. Then the patient asks that, can I join my work very earlier? Then the answer is the same, that yes, usually within 2 to 3 days, the pain is subsided after using of this medication. So if you feel like you can go to your office, you can join. Okay, so this was another, can I join my office? This was another concern. Okay, so these are the concerns of this PMR, and the hidden issue was PMR with GCA. Okay, and obviously the steroid. And for steroid, the drug using, so it is actually nowadays they're giving BBN, breaking bad news, plus drug introduction, both together. So obviously the scenario is very long, but inshallah, whenever you are practicing, you can cover it. Like Dr. Hiba, she covered, mashallah, everything she covered. She told me about PMR, everything. She touched GCA, even the drug also. She told the side effect, lowest dose. Just only you have to take in a tablet form. That was only missing, but it's okay. Tablet form, if I want to take, small things, that time only, yes, you can just tell that you need to take it tablet. And please, because actually there was no time, but if you have time, you can also tell that don't stop it abruptly by yourself. Okay, and if you feel like that you are having any kind of fever, or I think she told that side effect, that if you are feeling any red flags of the side effect of this steroid, come to us, and still we are going to follow you up, right? Our whole team will monitor you throughout your journey. Okay, so that's it about the breaking bad news, the PMR, GCA, and the steroid. Okay, any question from here? I think another was there, that is it familial? Another question was there, that can my child have this? So what will be the answer, Dr. Hiba? Can my child have this?
Mr. Sharon, the chances of your child having this disease is the same as anyone other having this disease.
Yes.
This condition does not run in families.
Very good. So it is not running in the family, but normal people who are having this, their child have more chance than the persons who are having this disease, their children are having more chance than the normal population. Okay, so this should be your answer. So these are the questions, I think. Any question from this scenario? Any questions, dear?
No.
Yes, dear.
What about the answer? Sorry.
What about the
Answer of the concern, is it curable?
Okay, very good. I didn't tell it, no? So is it curable or not curable? So you need to tell that it is actually not curable, that it cannot be permanently fixed, but yes, it is treatable. Within few years, okay, after using of this medication, you will be treated. But I'm sorry to inform you that sometimes also relapse can happen. Okay, so even after you are treated, if you feel like any symptoms like this or any vision problem, please visit us again. So it's not curable. It can actually, it's not like permanently you cannot fix it, but it can be treated. It is a treatable condition, but relapse is happening there. So this should be your answer. I'm sorry, I forget to answer that. Anything else?
And
Anything else?
which complications of polymyalgia we will tell?
Polymyalgia rheumatica complication, actually, you need to tell about GCA only. Nothing other than that. We are the only complication we are concerned about, the GCA, the vision affecting or not. Other than that, nothing we are worried about. Okay? So if GCA complication, if you are telling, you are getting 4 marks. That's it. They want to hear it. Anything else from PMR?
Mom, regarding the concern of the pain and how does it work, how many days, can I offer it like pain reliever till the steroid will work?
Actually, you cannot offer anything in your communication until it is written in your scenario. Here you are only like a postman we are working. Here something letter is given to you. You will just hand it over to the patient. Whatever it is written, you can only deliver that information. Extra information never ever utter. Okay, if it is not written here that painkiller extra, okay, very very nice question. Like patient can ask the same question you ask, that doctor, maybe before start, why you are not giving me for 2 to 3 days some painkiller so that I can at least establish. Okay, that time it is not your decision how you will answer it. Let me talk with our treating team. I will let you know what they are deciding for this. Okay, so you are not taking any decision, not even for paracetamol. You cannot tell, okay, take paracetamol, because this is usually as GP you can give, right? But in communication, in RCP, you are not able to do that. You cannot take any decision by yourself. Okay, dear?
Yeah, very nice reply,
Okay.
doctor. Again, that hypertension, she mentioned that her friend suffering from hypertension and worsening by steroid. How can we manage the situation here?
In that case, already our treating team knows about your condition. We will involve your heart doctor and also our joint doctor, and they will monitor you continuously whenever you are on this medication. So if need any modification of your hypertensive medication, the treating team will do. Don't worry about that one. We will all take care of it. Okay, so it is actually treating team decision. So you can, if specifically they are asking that hypertension I'm having, okay, so we will involve your hypertension doctor also, and if needed they will modify the dose. Sometimes maybe they will up it, sometimes maybe the same dose, but it's according to the response, right? It's not always that pressure will be high. But sometimes it can also be hiked up. So it depends on the response and the decision of the treating team. Whatever it is, rely or direct it, de-shoulder the thing to the treating team. Don't take any treatment decision from your side. Okay? Unless otherwise it is written in the scenario very clearly. Okay, dear?
Very nice. Thank you very much.
Welcome.
Clear.
Welcome, dear. Clear. Okay. So can we go to the next? Can we go to the next one? Dr. Saba is there? Dr. Saba Fatma, I think.
Yes, ma'am.
Yeah, welcome, dear. So
Oh, thank you, ma'am.
Okay, so I will show you your scenario. It's almost same, and that's why I choose together. So I want to discuss also something else. So I think you can see my screen, right?
Yes, it's clear to me.
Okay, so just take 2 minutes and then we will start, okay? Are you ready, Dr. Saba?
Yes, ma'am.
Okay, so I'll give you 8 minutes, dear.
Yes. Should I start?
Yes, what?
Should I start?
Yes, 3, 2, 1, start, please.
Okay. Good evening. My name is Dr. Sabha, and I am one of the doctor in this medical clinic today. May I confirm your name and age, please?
Yes, doctor. I'm Mrs. Devi Dash. I'm 40 years old.
Well, nice to meet you, Ms. Davis. Before starting our conversation, can you tell me what do you know about your condition so that we are on the same page?
Yes, yes, doctor. What is happening? I don't know. My face, it became so swelled up. Even my tummy for the last, I think, 14 days, it's become so puffy. Especially my eyes, around my eyes, it's horrible. My face structure is totally changed, doctor. Even whenever I'm going to pee, it's becoming like a whitish, like foamy. So I'm really afraid, doctor. What is happening with me? I went to my GP and they did some urine test, and also they took some of my blood. So I'm really worried, doctor. Please tell me what is happening with me.
Okay, I'm so sorry to hear about that, and I can understand that this must be very difficult for you, and we are here to help you. Um,
Thank you,
so,
doctor.
as you know, as you have already told me that your GP has done your blood test as well. So we have arranged this meeting with you to discuss the results of these tests. Are you comfortable if I discuss with you?
Yes, doctor. That's why I'm here. Yes, please tell me.
Okay. We have done your test, and that test shows that you have this condition in which the kidneys got slightly damaged, and I will draw this for you so you can
Wait, doctor.
get
You are
better
telling
idea
my
for this.
kidney is damaged?
You know that I'm drawing this for you. We
Okay.
have two kidneys in our body, and what our kidneys does that they filter our blood and remove some bad chemicals from our blood. So,
Okay.
in your condition, these we have a membrane that filter this whole process, that carry out this whole process. And in your condition, this membrane is little bit, it got little bit damaged. So some proteins are getting lost in your urine. Are you getting me till now?
Yes, doctor. Yes.
Yes, so no need to worry about that. It is a very manageable condition, and it has excellent results with treatment as well.
Okay, then it's good. So, what you are going to do, doctor? You are going to give me some medication through my blood channel?
We have we have a team of specialist doctor for this, and we will start your treatment according to your condition as well. And meanwhile, we will also book your appointment with dietitian as well, and they will also advise you to monitor your fluid daily water intake and daily salt intake as well as protein intake as well. Is it okay with you?
Yes, doctor. Yes, that would be great.
And then we will arrange another meeting with the special consultant, and our consultant will start you treatment, and we are going to monitor you throughout your treatment so that we can see that how our treatment is how our treatment is improving your condition. Is it fine for
Okay.
you?
Okay. So, do I need admission, doctor?
Well, as you know that till now your blood pressure is fine, and we can manage this condition as an outpatient. So we will start you the treatment, and we will follow up you throughout your this process, and we will book another meeting to see the results as well.
Okay, okay, doctor. Thank you, doctor. So is it you are telling I will be totally okay?
This is very manageable condition, and in this condition, the percentage is very good. And mostly patients do not have another attack. We will start the treatment, and we will patient take treatment for some time, and then we will taper off to a very minimal dose. And most patients have only one episode of this condition, but in some cases that is also very less percentage of people, they can have a second episode that we called as a relapse case. So we have also treatment option available for that as well. So it is a very manageable condition, and you will be having perfectly healthy life with this treatment as well.
Okay, thank you, doctor. And how long I have to take this treatment?
So we are going to start this treatment, and then we will going to monitor you. We will monitor your uh, blood test, and also we will
Minutes remaining.
monitor.
Go on.
We will check your lab results as well, and then once we see that this treatment is effective, we will then taper off, and we will continue to very low dose.
Okay.
And after that, if you remain fine, then we can taper it off as well.
Okay, okay. Thank you, doctor. Yeah, I was
So
really worried.
okay, so can I ask, do you have any other concern?
No, doctor.
Okay, can you tell me, Mrs. Davis, that do you smoke?
Yes, you told me that I have some problem with my kidney, and it's kind of they cannot filter it properly, and that's why I'm having this kind of swelled up face. But you assured me that you are going to have a good treatment, a treating team, and they will give me some in treatment, and I will be cured. It will be cured, and less chance of having it again. Right?
Yes.
Am I right?
Um, yes, you are absolutely right, and it's good to hear that you understood it so well. And Mrs. Davis, can I ask that do you smoke?
Yes, doctor, I do.
Okay. Well, smoking is not good for health, and I will recommend you that you will cut down your smoke intake, and I will suggest you to some social sport group as well in this regard.
Time finish. Continue. 2 minutes more. Continue.
Okay, and I'm giving you some leaflets for regarding this condition. It will help you to understand your condition better, and it will also help you to monitor your diet, and and you will be it will help you in your condition as well.
Okay, okay. Thank you, doctor. Thank you
Okay,
so
thank
much. Thank you. Okay. Very well done. Nicely done. Why did you tell that you are not good at communication? MashaAllah, you did well. Very well.
Okay, thank
Thank you.
you.
No,
I
no, no.
think I did not ask about it. Is it affecting your life?
No problem. Small things. That's why we are here, right? We are doing the session so that we can correct ourselves. But you are very good, mashallah. Okay.
Thank
So
you.
let me tell one by one. The starter, I think the important thing is if you can if you have the courage to do to attend the session, I mean, to participate it actively. I think this is the first quality, this is your first step that you are already good in communication, because without participating, only listening, it will never help. It will never help. Even I know one of my very nearest colleague, I don't know why, he's very good. I mean, clinically, he's very good. He's a knowledgeable person, mashallah. But he's having this introvert uh, type of a personality, and he doesn't want to practice. And the fact is that this is affecting his result every time. Now, this is the third time, and he couldn't pass because he's not practicing. He knows a lot. He knows everything, trust me. He knows better than me, better than who are passing. But he cannot produce it at the exam hall because he's not practicing, he's not talking. So whenever you are talking, the lackings, the fluency, it will be only covered when you are start practicing a lot. So practice is very important. It's not like that you know a lot. Everybody is knowledgeable here. You are thinking that after passing part 1, part 2, anyone is here is not having enough knowledge? Of course. Part 2 is the toughest exam in the world, I think, written type of, I mean, MCQ type of, this is the toughest. So whoever passed part 2 and part 1, they are very much knowledgeable. So passing PACES, it is not about the knowledge. It is about your talking way. It is about your smartness and how you are communicating, your body language. This is also important. If you are really having the eye contact with the examiner or not, with the patient or not. You are talking, but you are not looking at, you are asking question, you are not asking the question exactly to the interpreter. If they are asking you to talk to the interpreter, eye to eye contact. If they are asking you talk to the patient, eye to eye contact with the patient. This is the thing. They are actually watching if you are really good enough to handle patient in person, really in real life. Okay, that is what they are searching for. If you are smart enough to find out that if you are not I mean, in a condition that you will, somebody is dying and you will let them discharge from that emergency room, not like that. Okay, so it's not about knowledge. Everybody is here is knowledgeable. So the first thing is, please practice. Even if you know a lot, if you don't practice, you cannot produce it at the exam hall. Just write it down, and I have given you one real example. Okay, so let's talk about Dr. Saba's performance. Okay, first of all, I must say you did it very well, mashallah. But obviously, we are here to find out the small mistakes so that we all can learn and improve ourselves, right? So don't take it in your heart. Anyone's, don't take it in your heart. This is the way we are practicing, and you are already one step ahead, other than the other doctors, because you are already started. You have started practicing. Okay, dear. So firstly, your starting was very good, and you you have taken the golden pause. Regarding the test, this is one of the important thing. If you look at the scenario, here I told you that they have taken my urine and some of my blood maybe. So whatever the test you did, the test they have mentioned in the scenario, it is a must in layman language to tell the patient that we have done this, and the test results are with me. So you didn't mention about the kidney test, renal function test, it is mentioned here. Okay, dear. So better to tell that I told that my blood was taken. So I don't know why my blood was taken. It is for blood test or something else. So you need to mention that, yes, we did. You are very right that we have taken your urine and also your, blood. We have done already your kidney test and also urine test, and the test results are with me. And I'm sorry, Ali, this is not a little bit concerning, because this is not a bigger issue. This is not cancer. So a bit concerning. The results are a bit concerning. Take a golden pause. Then I will tell what happened, doctor. Is it something serious? Then you have to tell, okay, you are having the one specific thing. You need to mention the name of the disease. I think you didn't mention minimal change disease at all. This is the most important thing. Whenever you are telling a person, described me very well that what is MCD, minimal change disease, but you didn't tell me the name of the disease. So I don't even know as a patient that what is the name of my disease. So name of the disease, very much important, that I'm informing you that you are having this disease, then okay, explain the disease. That's not a problem. But name of the disease is very much important, even if it is a bigger name like polymyalgia rheumatica, or in short PMR. In next lines you can use the PMR, the abbreviated part. But whenever you are telling a patient, informing someone that you are having cancer, mesothelioma, you need to mention the full name, whatever it is written in your scenario. This is the Breaking Bad News first point, okay, dear? So this will carry a huge mark. So here, please be careful that you need to mention what the patient is having. Then the explanation was very good. You explained me that how it happened, that due to there is a, and membrane actually better not to use, maybe they will count it as jargon, okay? You can just simply tell that obviously your explanation was very good, just a modification little. What you can tell that maybe there is some your medical condition where there is a damage to your kidney. So ultimately, the filtration work is not done properly. So some proteins are leaking out through your waterworks. That's why it is becoming whitish and foamy that you have already mentioned. And also protein level getting low in your body. That's why you are getting this swelled up face or swelled up tummy or swelled up body, whatever she mentioned. Okay. So damage to your kidney. That's why what happened? Leaking protein through the waterworks. That's why waterworks foamy. So ultimately protein, if it is going out with your urine, what happened in the body? There will be, protein will be obviously low, and low protein, hypoalbuminemia. Ultimately it will cause the water retention. That is the mechanism, right? She also did it very well. The explanation was okay, perfect. But only the membrane, because you uttered the word membrane, better not to use 2 times. I think you mentioned better not to use the membrane, because membrane, they don't know the kidney structure and everything. Membrane we know as the doctors, but for them this will be a little bit medical terms. Okay, so better just kidney damage. So that's why the filtration is not working properly. Okay, other than that, you draw it and you try to explain it to me, and it was perfect. Okay, then the next was okay, you told about the group of specialists. That is a fantastic job you did, that the group of specialists. That was, I was going to tell you also, the previous Dr. Hiba, you told multidisciplinary team. Nowadays I think in 2 of the countries now they are telling not to tell the MDT. This MDT team also they are telling as jargon. Now they are getting irritated with this, some of the examiners. So why you are taking the risk? Okay, and they have cut mark, and they are taking it as specifically this Nepal, they have done it, and also another country I actually forgot. So don't take the risk, whatever your center. If you tell group of specialists, group of doctors, group of group of specialists, group of doctors. Okay, so it is okay not to mention multidisciplinary team or MDT team. Okay, it was before. This is, you will get in Alrox, some of the books they are mentioning, but nowadays they are getting irritated with that. Okay, this is one of the thing. So you did fantastic. You have done with group of doctors, and then you involved dietitian. That is also good, because already swelling up, obviously there will be, if the fluid retention, taking is less or not, in a certain limitation needed or not, that's important. But here actually one of the hidden agenda was a steroid here. That's why I chose it side by side with PMR. Steroid is important here. This is one of the hidden agenda. Okay, dear. So here, obviously, even after MDT, that's why I ask you, are you going to give me anything in my blood channel? No. We are going to start some medication. You will take it as a tablet form through your mouth. Okay. And it is the same, the steroid, all the things that the previous scenario we did, the same way we will do. What is the difference? The difference is timing. Here also the concern. Let us talk one by one about the concern. Okay. So I asked that how long the treatment will, because as she didn't mention about steroid, I asked about how long the treatment. So if you talk about steroid already, they will ask you how long the steroid I have to take. Okay, how long I have to take. So here actually it is like weeks, 12 to 16 weeks. So it will be few weeks, but it will be according to the response of your body, that how it is going to response, and we are going to, as our treating team will going to assess you, and then ultimately they will, if once you are improved, they will stop it by tapering the dose. Okay, so this is the answer. So that was PMR. So that's why side by side I have chosen these two scenarios, and both of them recent came. This MCT also Pune, I think the first carousel, second day I think it came. Okay, so they are repeating these things. So here PMR, if you see PMR, it will be longer period of time, 2 years, and if it is like a MCD, minimal change disease, then it's like 12 to 16 weeks. So that one is years, that one is, that is the only thing. Other things, side effect, it will be tapering, what are the side effects, how we are going to monitor, everything will be the same as the previous scenario, no change at all. There was another question from the examiner here in this specific MCD, that how doctor, I have why you are giving me steroid? I have my another. They have told that another medical condition, that my cousin is taking steroid for this reason. So why you are? This is my kidney problem. Why you are giving me this steroid here? How it will work? So here actually they are asking you how this steroid will work, mechanism. They are asking, huh? So how it will steroid? How it will help me? Because I have heard that this one is already used. One of my colleague, one of my mother is using for this. So now this is another problem, and you are giving me this. How it is going to help me? This was the question. So answer should be like that it will low down your defensive system, as because of the defense. If it is lowering down the defensive system, what will happen? It will reduce the soreness of the kidney filter, and kidney will take time to get improved. Okay, so that's why it will low down or calm down the defensive mechanism of your body. Okay, dear, and it ultimately reduce the soreness of the kidney filtration. So that's why it will help you to improve and to ultimately healing. Okay, it was one of the concern. Number third concern, I already asked her that, am I going to, is it, I think, is it treatable, or is it treatable or not? So she answered it very perfectly, but I think first you told it is not going to relapse, then again you told a few will relapse. Though what is the answer? Answer is that yes, it is treatable, very good outcome. She mentioned it very nicely. Even at the starting she mentioned it is actually very nice outcome. Okay, they have the good outcome, but few of we have learned, right? 1/3 it is cured, 1/3 it is recurred, 1/3 it is like it can be having chronic condition. So 1/3, 1/3, 1/3 like this don't tell, because this is so much changing. Recent cases they are studying, and this 1/3 is changing to some percentage. So don't give them a specific 1/3, 2/3. Don't do like that. So you can tell that yes, it is having a very good outcome. Mostly it is treatable, but few percentage they can recur. They can happen it again, and only a few percent people they are having the permanent scarring of the kidney, maybe need for further treatment also. But at the same time, whenever you are giving some bad news, it should be always in your mind, give them hope also. But mostly the cases are having very good outcome. Okay, excellent outcome. So this should be the answer. Okay, and I think another question, anything else? So steroid, if she should mention, then that time all the things, that don't stop it abruptly, and again, the side red flags, if anything you are seeing, your blood pressure is high, or you are feeling there is any tummy irritation. So steroid, all the red flags you need to mention. And not only steroid red flags, here actually two types of red flags also. If any bleeding, because kidney condition can be deteriorated. Okay, any bleeding through the urine, through your waterworks, any swelling in the leg, any breathlessness, this is for your kidney condition. And also for steroid side effect. Both you have to do in the red flags. This was also in the hidden agenda. Okay, so here I think no more question. Let me check. No, these were the only examiner's questions from here. How long medication? I told, totally curable or not. Do I need admission or not? Okay, this was also another examiner. They ask that, do I need admission for this condition? So again, if in the scenario, if you see that already they are telling that outpatient clinic, so already you know the answer. But if you don't know the answer, I mean, the scenario is not giving you the perfect scenario that she needs admission in further way or not. So how should you answer it? That it may need admission, but we will assess you according to the severity. If you really feel that you need admission, that time our treating team will inform you. Okay, so don't worry about that. Let's focus on the medication or on the treatment plan we are going. So whatever the unnecessary question, if they're asking, just drive them towards your path, because they will try you, because when you are walking in this way, they will try to distract you from another way. So just answer them, and better try to try to focus on your pathway, because you need to finish your path, right? Obviously the concern meeting is very important, there is no doubt, but sometimes unnecessarily they are asking one by one. So sometimes you have to tell, better if we focus on the treatment plan that we are having. May I continue? Are you interested to know about it elaborately? Yes, doctor. That time he will be also in your line. Okay, this is also the smartness. Then whenever he tries to distract you, just attract him to in your way. Okay, this is the way we should do. Okay, and another thing, Dr. Saba, you asked me about my understanding, but you had a more important task rather than asking my understanding. What were this? The social questions, dear. So smoking, alcohol, these are more important than asking about my understanding. Because if you ask me, even before smoking, alcohol, and my life, it is affecting my life or job life, it is affecting or not, driving if needed, here no needed. But these social questions are more important than checking the understanding. Why? Because checking, okay, dear. So you had time. So better you ask about smoking, but you didn't have time to ask about alcohol, right? And impact of job also, what I'm doing. So that one also you did, because I took your time. You asked me, you opened the floor for me. What have you understood? I talked a lot that I understand this. Don't do that. When do you need? Some cases, if you have time, it's not necessary. This checking of understanding is not carrying any mark. Not carrying any mark, unless otherwise there are some issues. We will talk about this one, like suicidal cases. They want dama, they want to leave the hospital. Okay, they want to leave the hospital. That time also you need to tell them that mental health assessment it has to be assessed. Okay, so checking understanding, actually, if you have only extra time, that time ask them what have you understood or not. Other than that, it doesn't carry any individual mark. So use your time very smartly, that this one is important, this is carrying mark, but this is not carrying mark. So better to use which one is important for you. Okay, dear?
Yes, sure.
Okay, inshallah, next case you will do better and best, inshallah, than this. Any question? Any question from this?
through
Ma'am, do
blood
we have
channels.
to ask about the complication of this MCD also, like infections, increased
Yes.
cholesterol, DVT?
Yes, you can, if you have time. This the same, the kidney affection. I told you that if there is bleeding or if there is in pain in the leg, but I mean, you can tell at least one or two. If you are touching just one or two, they will understand that you know the complications, the red flags. Okay, it is not important to tell all of them because you will not have time. But yes, whatever you have time, if you remember how many complications, you can tell. Okay, dear.
Yes, actually, this MCD is diagnosed on the kidney biopsy. So I don't know why they mentioned the blood test and urine test.
Actually, this is definitive. This is definitive. MCD usually definitive is biopsy. I'm agreed with you, but usually they're not going for biopsy. Usually they're starting treatment. If not improved already, then it's obvious that this is MCD. Okay, because biopsy is very interventional. I mean, it is you need to take the biopsy, we take the consent, and most of the patients are not agreed with that. They're starting steroid before even doing biopsy. Okay, dear.
Okay.
But obviously it is the definitive diagnosis is biopsy. There is no doubt. Okay, some of the cases are there, some of the diseases are like this, like sarcoidosis. They're not doing with, for definitive you can do the biopsy, but with the chest x-ray and other, the calcium level, the attacking the pattern, the clinical sign symptom, they're starting of steroid if it is like hypercalcemia or some other side effects. For definitively be definitive that it is confirmatory, to be confirmed, they're not going for any invasive thing, because if already the patient is improving, so no need to go for any invasive procedure. Okay, dear. The target is to heal them. Okay. Anything else, dear? Anything else? Any questions from here?
Concerns
Okay.
about blood channels or through which you will give me the medicine, I mean steroid.
I don't get your question. Blood channels?
Through my can I take it orally or by my blood channels doctor?
Okay.
If he
No, this
concerned
one,
like this.
if concerned, this is usually orally they're taking. This is orally they're starting. Okay. Unless otherwise, if it is IV, they will mention about that IV, but it is orally. Orally they are giving, and they're talking with the patient. So it's obviously the steroid orally they're starting. Okay. I just distracted her so that she would tell me the route of administration, that no, this one you have to take it by mouth, not in a condition that you need to take it by injectable. Okay. This is not in that. MCT usually orally it is healing. Okay. Anything else? Okay.
Concern about can I end with dialysis or renal failure or kidney failure?
Very good question. Yes, some few percentage, actually 5 to 10% people, usually they're having in the chronic kidney disease. But you cannot tell obviously the specific percentage. So how you will tell? And that I'm sorry to inform that yes, few of the cases, they can have like a scarring, permanent scarring of the kidney. It can go up to this level where the patient needs dialysis. But let's give you, let's focus on our, but in most of the cases, it is healing properly. Okay, so give him the truth, even if it is, even if it is very bad, because usually yes, 5 to 10% people they need dialysis. So you need to inform him, yes, there are some cases, few percentage of cases that permanent scarring can happen and dialysis patient needed, but as most of the cases are healed properly. So let's hope in your case also you will be healed. And please don't worry, our whole team will be with you throughout your journey, and we are going to take good care of you. Give him a very good hope. Got it, dear?
Yes, thank you very much. Yes,
Well,
it's very clear.
Okay. Anything else? And thank you so much. This was one of the concern. This was one of the concern that do I need dialysis? Thank you. That's why I'm telling you guys, please ask, do I need dialysis? This was, now I remember one of the candidates, she told me that it was asked that do I need dialysis in the future or something. So yes, the answer is this. Thank you. Thanks for asking, dear. Anything else from here? Okay, if no questions, so these are the concerns regarding these two. Regarding steroid, I think you all know now that how to do it, because two of the cases parallelly we have done. Related with steroid, two other communication cases are coming. So just let me ask you, then in short, I will tell you, and then we will finish our, because actually so many communication cases, we cannot practice each and every one. But at least the main theme, if I can tell you, at least if it comes to your exam, inshallah, you can participate very well. So regarding steroid, also two other related communication is coming, that steroid induced psychosis. So how it is coming? Steroid-induced psychosis, they are telling that patient is, the scenario came like that. The patient came with vision problem and the same type of muscle pain, and ESR was high. So because they suspected this, that this was GCA, so they started steroid. But after the first dose, the patient got started to have psychosis. And now talk with it was a female. So talk with the son that the mother is started to have this steroid-induced psychosis. Okay, so this is one of your scenario. Now answer me. What is this? Is this error or is this the side effect of the drug?
Side effect.
Side effect. Side effect of the drug.
Excellent. So this is your side effect. Okay, so this is the side effect. Obviously, this is not common. This is a rare side effect. But unfortunately, so I told you, there are some key words that you need to memorize. Okay, so obviously, it is not a common side effect. This is a rare side effect, but unfortunately, it happens with your mother. So unfortunately and rare. These two words, at least remember to explain it as side effect. If it is rare, most of these side effects are rare, because when you are giving the steroid, the last two cases, did you mention about psychosis to the patient? No. This is a rare side effect. We are mentioning about the tummy irritation. We are mentioning about the high blood pressure, high blood sugar, and skin thinning even, then bone thinning. All we are mentioning, but psychosis, no, we are not mentioning. Why? Because it is rare. But unfortunate, it is rare and it is not common or uncommon. So this is your keywords. This is your keywords that you need to explain to the son. That actually this is rare, this is not common side effect, but unfortunately it happens to your mother. Okay, so unfortunately happens. That's it. If these key words you can remember, you can pass it very well, very smartly, without, struggling with your tongue. Okay, so this is the thing, that this is actually side effect. Okay, then psychosis whenever happen, then here some of the actually concern was also there, the management plan. Okay, they will ask that why you have started it, even before confirming that this is the you are telling some blood channels problem, some soreness in the blood channels, and now you are telling that no, it is something else. So without confirming that, why did you start this harmful medication? You knew that, you intentionally started that, doctor. The son is angry, he could tell like that. Okay, so that time your answer should be that. And obviously, whenever the angry patient you are dealing with, be very polite. Your body language should be very polite. It's not like the hunching is forward, but it has to be very politely, modestly, and calmly. They can be angry, dear. Let me tell you one example. In Oman, a royal hospital, one died. What happened? Communication case. The angry patient, he was so angry, He just left the station, slamming the door. And the candidate was sitting there. Trust me, this is real. And for each candidate, the person did the same thing. This is one of my senior brother. Before a few years, both of them at the same diet, they've sat together. It was not only for him. He thought it is for him only, but for when he was outside, he asked the other senior brother. He was also telling, yes, he did the same. Every time the patient, he just slammed the door and went outside of the station. And even 1 minute, I don't know how much time he was telling, I was just sweating, I was waiting, examiner was waiting, because you cannot talk with examiner, right? So they were just silent and he was waiting. And after maybe, I don't know, maybe 30 seconds and 40 seconds, he was telling to me, it was like so many minutes after that he came back. And he came back. That time he was calm, and they finished the communication station, and mashallah, he got full marks over there. Because the reaction, if the patient is angry, you cannot get angry. You need to be modest. Whatever happened in the examination hall, you need to think that you are the doctor over here. You are the most calm person over here. You need to make him understand. It is their right that they are getting angry. It is their right that they're not understanding this. But it is your responsibility to make the environment, the conversation in that way that you will convince them. Okay, so whatever situation happened in the examination hall, don't panic. So even the patient can go out of the station. It also happened. Okay, dear. So this is the worst scenario I have heard till now. But he got very good, full marks in that communication. Anyway, so where I was, so this patient, so they were asking, why did you give my mother without consulting, without being confirmed that this is this blood channel problem? So in that case, your answer should be that actually, whenever in our medical practice, whenever something like that, we are highly suspicious of this type of serious condition, in the best interest of the patient's condition. Another keyword, best interest of patient's condition. We are starting the treatment as early as possible to save the vision of the patient. So that's why we have started. It was actually done in the best interest of your mother's condition. We did it. Why we did it? Our intention was good, right? So this one line is enough, that it was used in the best interest of your patient condition. And in our medical practice, we are using this as imperial treatment. We are starting it. Okay, so that's why we have started it. Okay, but again, I'm sorry that it has caused this side effect with you, but don't worry. We are here with you to support your mother. Already we have a best group of specialists gathered. We are having our mood doctor. We are having our, because it is GCA, our joint doctor, our eye doctor, everybody we involved. And what we have already done something, we have already done some measures to improve her condition. What are the things you have done? What are the plan? So we have done what we have done. We have stopped the medication. You must tell if any side effect. Okay, immediate. Stop or minimizing. If you are not sure that it will be stopped or not, you can tell the treating team will decide to minimize it or to stop it. Okay, here you can understand that steroid is not the medication for the GCA, because the scenario was it was not GCA, something else, something migraine or something was there. Okay, so here obviously steroid will not work, so now you can stop it. So we have already stopped our medication. Our group of specialists, we have involved our mood doctor. Okay, mood doctor and also nerve doctor to treat his eye condition. I think he has, in that scenario, the eye vision was affected. That's why they started, right? So now we have involved the mood doctor, not MDT. I should. So important here, the mood doctor, and nerve doctor, neurologist, okay, to treat his eye problem, and we will do some more tests, okay. And last, what, obviously we will admit her, because psychosis is there, okay. So we will admit her and observe her till she is getting totally improved. If the patient is telling that no, I want to take her at home, at this condition, better to make her stay at the hospital till her this mood problem is going to be improved, okay. Even if they're telling that, okay, doctor, now maybe she will be fine, after I'm returning home she will be alone, if again happened with that, what my mother will do, one of the concern, that now maybe you are telling that you are admitting her, you are treating her, she will be fine. So is there, if she's going home, she's alone, I'm staying in another part of the country, so how you are going to help her in that case? So we will provide social service to take care of him when he will go home, okay. So we will provide the social service according to the concern, whatever they're asking, try to meet their concern, okay. Try to give them some positive hope, some way to recover, okay. So these are the concern, I think. Another concern, that it is permanent or not. It is, tell me, is this reversible or irreversible, this psychosis? Anyone?
In most of cases, it's reversible.
Very good. This is reversible, usually. And also only one, the scenario was with only one medication, okay? So yes, this is mostly reversible, okay. Why I finished this one? Any question from this? Or otherwise I will go to the next. Any question from this side effect? Okay, so plan, any of the side effect, plan is important. You need to be sorry, but don't apologize. There is difference between apologizing and being sorry. Sorry means you are feeling sorry. You are feeling sorry, some sympathy, that yes, I'm sorry that it happened to her. But whenever you are apologizing, that means you are carrying the mistake in your shoulder, that we have done something wrong. That's why we are admitting it. So at least in PACES, use apologize the word only if it is definitive medical error. Better. Some people, they are telling one time apologizing, it is okay. But I have got candidates, what their feedback, that the word apologize they use, that's why they cut mark. So please, why to take the risk? You can be sorry, but you cannot apologize unless otherwise it is an error. There is a difference between these two words in your communication, okay dear? So here you can be sorry, but don't apologize, please, okay. This is one of the thing. With steroid, the next side effect, another one was there, okay, already I told you that, which one was there? Avian, avascular, what is that telling? Avascular necrosis, right? This is also side effect, the same thing, okay. This is also your side effect. But what is the difference between these two? This one is actually irreversible. This side effect is usually irreversible. And this scenario, usually the patient is chronic user, right? Avian is not happening within 1 dose or 2 dose, never ever. So it must be a patient, the scenario was very, the patient was steroid for any specific reason. So it was for longer period of time it was happening. So here, stop directly, you cannot tell. So diplomatically de-shoulder it to your treating team. Tell the treating team will decide if what to do about the modification of the dose of this medication or to stop it. They will take the decision. If it is not mentioned in your scenario that what to do, okay, because you cannot stop it by yourself. Because here the steroid, it was used because of any specific reason. Maybe the patient was having IBD, or the patient was having something serious condition that need to be on steroid for a longer period of time, dear. So in these cases, you cannot stop it by yourself. But psychosis, one dose, and GCA, it was not GCA, something else, some other eye problem. In that case, you can stop, no problem, one dose. Here, you cannot stop it by yourself. Okay, this is the one thing. Is it reversible or irreversible? It is irreversible. How an MDT team involvement? Here, you will involve your occupational therapist, because maybe he will need wheelchair, clutches. Okay, physiotherapist, you will need it, and also even surgical procedure if needed. So you can give him the options. Okay, you can give him the options. Okay, so these are the MDT team involvement. Not stopping, obviously. Number 2, group of specialists, including the occupational therapist, so that they will provide, if any type of dependent things he needed, like clutches or maybe wheelchairs. If he needed anything, they will provide it. And also we will involve our physiotherapist. Okay. The other portion, same. This is this is actually very rare, not common, but unfortunately it happens to you. Okay. So these are the thing with your steroid. Any question?
Yes,
Any
ma'am.
question, dear? Yes, dear.
Regarding this team, can we involve also orthopedic surgery or
yes,
surgeon?
Wound doctor. Yes, sir. That's what, whenever you are telling that, we may include our surgery department also. We may, because you don't know surgery, if only surgery is indicated, that's why, because they will assess. And very, very good question. One of the concern was that, do I need surgery? This is, our treating team will assess you, and if they're after assessing you, they will be in a conclusion or in a decision if you need any surgery or not. In that case, we'll involve our surgeon also in our group of specialists. Okay, dear? Because if don't need, we are not involving. So you can tell like that. Our treating team will assess you, and after assessment, if you need any surgery, obviously we will involve our surgeon. Okay?
Yeah.
Anything else?
Mom, again, yes. If the patient or he mentioned that they didn't inform me about this side effect, like steroid can cause a vascular necrosis, can consider it like error?
No. Why not? Because here what you have to tell, as I told you, that usually we are not telling about avascular necrosis, last two topics. Even if when you are practicing, you are giving steroid, we are not actually discussing about avascular necrosis. We are not discussing about psychosis. These are really very rare and long, especially this AVN is long-term side effect. Okay, so you need to tell like that. The commonest side effects, I'm sorry, I really appreciate your concern. And I'm sorry that it was not discussed with you. Actually, the commonest side effects we are always discussing, and also we are always providing the brochure and leaflets, including all the side effects. And I think if you have read through it, you should know about this one also. In the brochure and leaflets, all the side effects are written over there, because there are so many side effects of one medication. It is not possible in one sitting to tell about so many side effects. So rarest side effect we are usually not discussing. In our medical practice, we are discussing about the commonest side effect that people are suffering. But of course, always we are providing, and I'm sure that we have provided you with the brochure and leaflets regarding all the side effects of that, including this one also. So it's not like that we didn't tell her. We have given her leaflets. Okay, but it was not mentioned verbally, but it doesn't count. We have given her leaflets so that she will read through it. It's not possible steroid there. If you are searching more than maybe 25 side effect, you can utter, right? From head to toe. We are not telling them. So the commonest we are discussing. The others, we are giving the leaflets. Okay, dear?
Yeah. Clear. Thank you very much.
Welcome, dear. Okay. And this is not in this case. some other, I forgot, same type of answer should be the same. That why didn't you tell me about this side effect in my, so this should be your answer. That the commonest side effect we are discussing, but the rarest one, that's why we are giving the leaflets and brochures. And I'm sure that you got it. And I'm really sorry that it happened to you. Again, be sorry with her. That we have given you, but still I'm sorry that it happened to you. Okay, dear? That's it. So whenever you are giving her, emphasizing that no, you did the wrong, you didn't read it at the same time, but you at the same time assure her that no, it's okay. We are sorry that it happened to you. Okay, that's the way. Okay, I think we have done, alhamdulillah. Inshallah, after Eid from 4th June, hopefully we will try to discuss 1 month totally. I have targeted 60 cases, recent cases, along with that, like this 2 or 3 cases. So hopefully more than 60 we will cover, inshallah. So be with us this June. We are going to have a marathon over our communication, and hopefully who are participating, inshallah, I can assure you, you will obviously improve more than 60 to 70% if you are participating. Trust me, you will find yourself in the stage of improvement, inshallah. And try to participate, dear. Whoever, from whichever country you are just joining us, try to participate, okay? And thank you so much, Dr. Saba, Dr. Hiba. Excellent performance by both of you. I salute both of you just because you have participated. That is the courage, okay?
Thank you so much, ma'am. Thank you.
Welcome, dear. Welcome. You did very well, Dr. Saba. And Dr. Hiba, before also she did well, mashallah. Yes, Dr. Hiba, welcome, dear. So see you, inshallah, on 4th June at the same time, inshallah. If any time changing, before 1 or 2 days, I'm announcing the time. So, inshallah, we will discuss.
Thank you.
Okay?
Thank you very much, Mom. Really very digestive session.
You. Thank you. Thank you.
Appreciate it very.
Thank you so
Thank
much.
You very
if
much.
it helps a little bit, anyone, alhamdulillah, this is the happiness I'm getting. Thank you. Thank you so much. Assalamu alaikum.
Salam.